Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Miriam Zilbergleit and Ricardo Correa. Miriam, we've had on the show several times. She's an internal medicine physician. Ricardo is an endocrinologist, and together they wrote the article, COVID-19 Vaccination, the Latinx Experience. Miriam and Ricardo, welcome to the show.
Thank you. Thank you for having
So
us.
we'll get into that article in a little bit, but I'm going to ask each of you just to share your stories and journeys to where you are today. Miriam, why don't you go first?
So, as you well know, I am an internist. I am Latin, even my last name doesn't sound like that. I am originally from Peru, where I practiced medicine for 10 years. I am very into wellness, and I don't see myself separating wellness from inclusion and diversity. So even this topic doesn't target my number one interest, wellness, so clearly. Really, we need to focus on inclusion and what happened with minorities to really offer wellness to all the community.
And Miriam, so tell me how your background as a Latinx, how does that influence your profession as a physician?
So I always say that I practice medicine in the Latin way. And during my career in Peru and my training, being close to patients, almost part of the family. Doctor is well respected, appreciated. We treat our patients as family. So I have been trying to practice that type of medicine here. Forget a little about the times and metrics, which are very important and we need to fulfill, but focusing on the patient as a human being and treating them as my family.
And Ricardo, can you just briefly share your story and journey to where you are today?
Yeah, so thank you first for having us. So I'm an endocrinologist by training. So I'm originally from Panama. So I did medical school there and then postgraduate medical education as Miriam traveled to the US. I was in the East Coast, first in Miami as a resident and then in Maryland as a fellow. Moved to the Rhode Island, very close to you. So I was in New England for a while and then moved to the West Coast to Phoenix, where I'm right now practicing. I'm in the academic setting, so I am the program director for the Endocrine Fellowship. And during this time being in Phoenix and realizing that something that I will always tell is that I felt more a minority when I arrived to Phoenix than when I was in Rhode Island. Mm-hmm. That everybody will think this, the opposed, being Arizona, 30% of Latinx community and 40% in Phoenix. So I started getting a lot of involvement on the diversity, equity, inclusion movement. And I was able to get involved in the university settings as the director for diversity and graduate medical education. And then with the pandemic, definitely a lot of the things that I was seeing just locally was flourishing nationally about the disparities that were happening. And then that gave me the opportunity now to explode and say, hey, this is nothing new. This is something that is happening constantly. And now you're realizing it, but it's nothing new. And then having the opportunity to interact with the community and then expose this to the public using the Spanish TV here, Telemundo, Univision, using other medias and having that impact that has been very helpful. I think that always we see the bad thing of things, and there's so many bad things that the pandemic brought, but the positive is that then people start realizing that this was happening and now they want to make some changes and there's a commitment. And in that journey, I met Miriam that has a similar interests, and I thought that pairing together to tell about the story, our story, and the story of our community to the physician community, because we have been telling this to the public, but to the physician community, what is happening, it was important.
All right, so let's talk about that article that both of you wrote. It's titled COVID-19 Vaccination, the Latinx Experience. Miriam, I'm going to ask you to summarize that article and share the reasons why you and Ricardo decided to write it.
So the article really is a review of many other articles that were published during the last couple of years. And we try to bring first a little of the idea of how big is the Latin community in this country, and how many difference are between the care that they receive and the care that other communities are receiving. And this is beyond the healthcare per se, but it's also is focusing the attention that they receive, right? While we talk about other minorities that deserve to be being considered and that need extra help, the Latin community has been always very silent. When reviewing the statistics about not only vaccination, that was kind of at the end of the process, but morbidity, mortality, complications, understanding of the rules that we were supposed to follow in order to protect ourselves and our families. What we found in this review of articles was that the Latin community really was dealing with a serious problem. The mortality was very high, beyond even the African American community. Morbidity was also in the higher range, and the lack of education or the possibilities, and especially the fear. That is something that I believe that was for me the most traumatic part of this review, is people fearing to ask for help or to go to the hospital because they were afraid of being moved to their countries, back to their countries, or being penalized for being immigrants. So what we are trying to do with this article is to create awareness, to explain the specific characteristics of the Latin population, the specific needs, including these type of fears that we need to consider. We are physicians, we are not here to judge, we are here to support and to care, and to also explain that if we don't take the time to understand the social aspects, the emotional aspects, and the cultural aspects of the patients that we are taking care of, we are not practicing good medicine. And that's actually the reason why we did this. We wanted to create awareness and help our communities.
And Ricardo, can you tell us a story or a case study of a patient or a group of patients that you've seen that really illustrates what Miriam has been talking about regarding the obstacles to care that the Latinx community faces?
Yes, so something that very importantly you mentioned was seeing the Latinx community as what it is. It's a different culture, multiracial. So we don't have one race in it, it's multiracial. And understanding not only what I have seen a lot of times is that I speak Spanish and that's enough. So it's not just understanding or having the translation or having translator, but it's understanding the culture. So one of the things that happened here at the beginning of the pandemic was, yes, the people were saying you need to get tested if you have this kind of symptoms. And they established in Arizona centers, like the stadium was a center for testing and other big centers. So people need to go in a car to get tested because you have to go to this place that was certain far away from place. This limitation, Latinx community, we know their lower socioeconomic status, more in border states where they have to most likely undocumented immigrants. Second, they went there and what they are seeing, police and ICE. Why ICE are in the surrounding of a testing center of a public health emergency? Why was ICE there? So then they start creating more reluctancy, more fear that they already have, but more fear to go to the healthcare system and ask for help. And then, of course, they start getting contaminated. And then these were the people that for certain predisposition, not everything has to be genetic, but certain predisposition in genetics, there are more diabetics, more obese patients. And then they finally get the end point of the disease that was dying from it. So that was one part. Other part of the population, they were afraid of going, because if they were diagnosed, then they will not be able to go work. And these were the population that we didn't have opportunities for have telework. There were many people that, yes, they have the opportunity in medicine, we have telemedicine and then telework, but these are the janitors, the maintenance people, the people that have to go to the farms. So these are the front lines to a certain point, and then they were unable to get sick days that were paid. And this is another big topic, why in the US we don't have paid sick days. And then these were the people that didn't want to get tested, didn't want because they have to go to work, but their work is the one that was in the front line that more likely will get the COVID. So this was a population also that suffered the most. Another cases was patients that, as I mentioned, they didn't want to go to the hospital because the other thing was that during the beginning of the pandemic, then it was stopped. But during the beginning of the pandemic, we have the public charge rule. This is a rule that states that if you use federal funding for something in your process of legalization, then you will get hit down by that, and you will not get finally your permanent status. So they were worried about using these systems because then they will get penalized, as Miriam mentioned, and not just worry about getting back to their country, but worry that they cannot get official status in the US. So then it was that was at the beginning, it was stopped. We moved to the vaccines. Yes, okay, perfect. We solved that issue. There were many things that were done, a lot of education to the community, but then the vaccine came, and then it was another problem. There were no translation to Spanish of many of the documentations of this. So just in Arizona, for example, the vaccination started December of 2020. By end of February of 2021 is when the Arizona Department of Health was publishing something in Spanish. So 2.5 or 2 months where there was lack of documentation. So then that was also affecting the community. We needed the vaccine. We needed to end a public health problem. It was not a problem of different race, ethnicity. It was a public health problem, but we didn't provide the resources to them. And this just perpetuated the problem. I think that something that we can get from this, and I have talked to Miriam about this, is as community where we care for different race, ethnicity, was in understanding this culture. In this case, we have the experience. We were helping in an underserved clinic, and then making that clinic the center for the community. So where they feel that there is a trust to that clinic, the people that are telling you the news are people that they trust. I always have the comparison. Yes, Dr. Fauci is a great source of information for us, for scientists, for medicine, but for the community, Dr. Fauci doesn't represent anything. Mm-hmm. So the ones that they will believe will be the doctor that see them every day. Then making that empowering community healthcare workers to go out. We did door-to-door knowledge. We did radio. Even I was very surprised because we are in the world of the social media, mm-hmm. but there are older Latinx population that they use radio. They still use radio, and the radio is very important for them. So using that things that if you don't understand the culture, you will never understand that, to promote the scientific evidence of things and then get them more vaccinated. And we saw this. The beginning, they were the patient, the race ethnicity with the majority of reluctancy, mm-hmm. and that decreased a lot. They fall in the third or fourth place mm-hmm. of reluctancy, just because a lot of the Latinx scientists and medical providers were doing this effort in their own communities and becoming the center of knowledge for that community.
And Miriam, take us into the exam room when you talk to a Latinx family and they express some of these concerns or have some obstacles to care. Take us into the exam room. Tell us some of the conversations that you have to help alleviate those concerns.
I will say that the first thing that I will do is speak in Spanish, even mm-hmm. if they speak English perfectly. And that's something that creates a very interesting connection. When they know that I am Hispanic, I don't know, their faces change tremendously. So that has been a very interesting process. I talk to them really as family and friends, and I start like that. It's like, I will tell you what I am doing with my family. That's exactly what I say. I will share the story of my parents that are elderly. I will tell you about my kids and what I am doing with them. I will give you the pros and cons. And normally I am very transparent and I express my own fears. I remember telling them that I was in the car for 30 minutes thinking about right and being afraid what happened if something happened, and why I made the decision. So I become part of them and their family. I use transparent information and I admit what I know and what I don't know. But again, I believe that what Ricardo was saying is so important to allow them to feel that they belong, that they are not different, that they are accepted, for us to feel also that we belong to them, so we can create a real connection. And that's really my trick. It's not very sophisticated. It's just being transparent and respectful.
We're talking to Miriam Zilbergleit and Ricardo Correa. Miriam is an internal medicine physician. Ricardo is an endocrinologist, and together they wrote the Kevin MD article, COVID-19 Vaccination, the Latinx Experience. Ricardo, for those clinicians who don't have that shared cultural background, and you mentioned there are a lot of misconceptions and misunderstanding about the Latinx cultural background, what are some pieces of advice that you could share with those non-Latinx clinicians to help connect with this population?
Yeah, and this is a great question, because we don't have to have the background. We don't expect that every physician have the background of being Latinx to understand the Latinx community. I think that it's just that connection that you put as a physician to understand what are the patients that you are seeing, and reading a little bit about how the structural, the social determinant of health plays a role in those populations. Sometimes it's going to sort resources like the National Hispanic Medical Association that have a good program on understanding the Latinx community, but other times it's just going to some other resources, or asking your colleagues that probably have more experience, or they have been dealing with the population, because that way you understand certain things that is not usual in other cultures. One is that the Latinx community is the role or the owner of the health of the family is the female. So it will be in sometimes the grandma, other times will be the mother. And you have to understand that, because whenever you give a recommendation to a male, they will rely that to the female of the family, and then they will, a lot of the things will come from them. So empowering, something that we have a movement called Latina Strong. So it's empowering that females to, besides being the responsible of taking care of all the family, they do other things. So understanding that is important. Other things that, for example, in COVID, we realized is that there were a lot of recommendation coming from the grandmas, the grandparents, that were really applicable in this condition. And a lot of the patients were coming saying, hey, yes, I took a hot tea to kill the virus in my mouth. And I said, who told you that? Oh, my abuelita told me that. And then you have to deal with that you have to deal to, you cannot say, do not believe your abuelita, because they will never do it. This is the culture. So you have to say, hey, no. So at this time, probably your grandparents are not aware this is totally new, and try to understand that kind of culture. So resources, I think that there are a lot outside there. The Latinx community represents 18.6% of the entire US population. Probably by 2050, it will be 1/3, more than 1/3. So it will be not anymore a minority. So what we need to is educate ourselves with the population that we're seeing. In this case, we're focusing on the Latinx, as what are the things that the culture have that I can use as a physician or as a healthcare worker to potentiate my message and to make them understand where I'm coming from, and that they don't feel that I'm just against everything, but I'm just trying to understand and then appearing with them. I always believe that health is a co-work. The patient is one part, the healthcare worker is another part, and then with that, I think that will solve a lot of the problems and more with dealing with Latinx. And when I'm focusing a lot is probably the older generation or the middle to older age. The new age have more understanding. They have been in this country for several years, and they have a little bit of understanding, so we can utilize. But the older generations are still in that phase where a lot of their back culture, a lot of the herbal things, a lot of the over-the-counter things still work for them. A lot other thing that I faced was a lot of how to deal with the religious belief. A lot of them in Latin communities are Christian, Catholics. They were coming, yes, if God will protect me about this, and how to deal with that. And you have to understand also, I will tell them, yes, God give the power of science to the humans, and that's what we are utilizing here. But if you say, do not believe in God, then boom, you break that empathy that you will establish with that population.
And I'm going to ask each of you one final question, and it's really your take-home messages to the Kevin MD audience. Miriam, why don't we start with you?
So I want to say that even we are talking about COVID and vaccination right now, this goes beyond COVID and beyond vaccination. This is something that applies to any other condition: cancer screening, diabetes, diet, cardiovascular disease, etc. So we can learn from what happened during COVID, create the awareness, make ourselves aware and create social awareness, and identify those gaps and try to fill them. You were asking what we can do at some point to change what is happening right now. And I believe that number one is educate any future healthcare worker on diversity, inclusion, because it's something that really changed tremendously the outcomes on patient care. The second is reinforce empathy and respect, which are big part of what we need to, embrace as physicians, as a human beings too. Also educate the community, right? While we need to educate the healthcare workers, we also need to educate the community. This is something that needs to happen at the level of the schools or high school, college collaboration, and make sure that this community that is growing, right, to at the point that will be a third of the US in the next few years, receive the care that they need for themselves and the care that we need as a country. Because if we have a community that is sicker, is a community also that is using more resources, and it's a community also that has more risk of disability and will not be able to work, and again will need more help and support from the rest of the community. So even if we don't think about them because of the group or the human being, even in a business, concept, it's a good investment to take care of them and to help them. So all of us, we have a good future in the healthcare system.
And Ricardo, what are some of your take-home messages?
Yeah, so I totally agree with everything Miriam say. An extra thing will be increasing underrepresented minorities in medicine. So in this case, we feel that and Miriam mentioned, whenever she see a patient, she connects with the patient because she starts speaking Spanish, she understands the culture. So we need more people that understand different cultures in medicine, where it will be different from state to state. I always say, like, yeah, I don't expect that North Dakota have the same amount of Latinx physicians than Arizona, but that's something important. And the only way to start doing that is from what Miriam mentioned, from middle school, elementary school, trying to tell them that they can make it. These are populations that are suffering because of toxic stress, systemic discrimination. So you have to make them believe that they can be in any part of the healthcare workforce, and then just trying to make that bigger. With that, we will see a different, probably not in our upcoming years, but in the next generation, we will see totally a different. And the final from this is that really all these disparities that we were talking about existed before COVID. COVID just flourished. And I think that it's a responsibility for all of us that are working the healthcare, is to understand the social determinant of health of the patient, and to put that together into our visits. Sometimes I see that, yes, just go outside and walk 15 minutes to decrease obesity, and the patient cannot do it because they live in a zone where there is a lot of criminalization, or there's a lot of neighborhood that they cannot go and walk. So understanding that is very important. It should be integral part. I think that the medical school at least are doing a very good movement of putting this together in their curriculum, but there's a lot more work to do. So this is not the end. This is just probably the beginning
Mhm.
of a national movement that, as I mentioned, the good thing of the bad was that at least people start caring about this. When in the past we were a small group of us just caring about this, now it's a bigger group, and we need that everybody care about this.
Well, thank you both for sharing your time and insight, and thanks again for being on the show.